Have you ever been asked, do you have celiac disease or gluten intolerance? Or have you heard that there's a difference and you want to understand why? I'm going to give you a quick lesson on the differences between celiac disease and other forms of gluten intolerances. My name is Cynthia Kupper. I'm the Executive Director of the Gluten Intolerance Group. And this is a quick little lesson on food sensitivities related to gluten. Basically, when you look at food sensitivities, there's two types of food sensitivities that we're talking about. There are allergies and what we call food intolerances. In the allergy section, there's basically two types of allergies. There are the IgE allergies, which are the allergies that we all know about. Peanut allergies, milk allergies, eggs, soy. The top 8 allergens that the FDA has been mandated to make sure are on all labels and clearly labeled. There's also another type of allergy called a T-cell allergy. A T-cell allergy is very different from an IgE allergy. And if celiac disease weren't an autoimmune disease, it would be considered fully a T-cell mediated allergy. So it has a lot of the same characteristics. Food intolerances, on the other hand, are not allergies at all. They're simply the body's inability to tolerate certain types of foods, chemicals, and have reactions as a result of those. And they're broken up into 3 types. When we talk about allergies, we're really talking about fast-reacting allergies versus slow-reacting allergies. An IgE-mediated allergy is an allergy that can cause immediate and sudden death. So the reaction time is very quick, And again, it's the top 8 allergens. Where a T-cell mediated allergy is what we call a delayed allergy. The reaction may not happen for several minutes to several hours, and it does not cause immediate death. What happens in a T-cell mediated allergy is it damages the intestinal tract. And so what happens is you start malabsorbing. And in that malabsorption, that can cause starvation or malnutrition. And that could cause death. But it happens over a very long period of time. Food intolerances, on the other hand, can be to proteins, which allergies are always to proteins. So gluten is a protein, and that's what people react to when they have celiac disease. Casein is the milk protein that people react to when they have a true cow's milk allergy. But with food intolerances, it could be a protein, it could be a carbohydrate, or it could be some other chemical in the food that causes a person not to tolerate that food. And food intolerances are basically broken down into 3 types. Metabolic, which basically means your body doesn't tolerate or isn't able to digest the foods very well anymore. So for instance, the most common food intolerance that we know about is lactose intolerance. As Caucasians get older, they tend to not be able to break down the milk sugars as well. And so they start having gas and reactions related to the milk sugar. There is also a reaction that is pharmacological. So what happens when you digest the food is you develop a reaction between the brain and the gut, and it is caused by the food itself, or the breakdown of the food and the chemicals in it. And then there's a whole group of intolerances that we really don't understand. We call them idiopathic. We simply don't know what causes people to react to caffeine or to react to food colorants, but some people truly do. These are not allergies. They do not cause damage to the intestinal tract, and they do not cause death. So they're very different from allergies. Basically, they're irritants. They're just annoying to have happen. When we look at gluten intolerances that are related to intolerances, not allergies, and these could include things like autism. They could also include, some research would suggest MS, multiple sclerosis. Some people with skin disorders, such as psoriasis, may also have relief from a gluten-free diet. We're seeing people with neurological problems not associated with celiac disease, such as migraines. Now, please remember that people who have celiac disease may also have migraines, but some people, when we test them for celiac disease with migraines, they don't have celiac disease. There's also a condition called ataxia, and sometimes this is associated with celiac disease, and sometimes it's not. There is a condition called gluten ataxia, that is not associated with allergies or celiac disease. And of course, there are a lot of people with chronic fatigue, chronic pain syndromes, or just plain the inability to digest the gluten. And we don't know why these people have this problem, but they don't digest it well. These are all types of gluten intolerances that are not truly celiac disease. With an allergy to wheat, also sometimes called a gluten allergy, the reaction to the protein may be different than the reaction to the protein gluten with celiac disease. There are over 50 proteins in wheat, and we can have a reaction to any of those. It is also not uncommon for people with celiac disease to have also a wheat allergy. So you may have a reaction that causes damage because of celiac disease, or you may have a reaction that causes asthma and things like that that is related to a totally different protein. Why do we care? Well, here's why you care. First of all, it's very important to get a diagnosis, and how you get that diagnosis is very important too. With celiac disease, there is a diagnostic criteria. What that means is, if you ever wanted to participate in research studies or when a medication becomes available for people with celiac disease, if you don't have a proper diagnosis for celiac disease, you won't possibly qualify for that medication. The proper diagnosis for celiac disease is a small intestine biopsy that is positive for celiac disease and return of your health on a gluten-free diet and the normalization of antibodies specific to celiac disease. With IgE allergies, the way we test for those and diagnose an allergy is with skin tests and blood tests called skin prick tests or RAST tests. It should be followed up by what is known as a double-blind placebo study. That simply means that the patient and the person giving the patient the pill does not know whether or not it contains the allergen that the patient is suspect of being allergic to. This is always done in a controlled environment in a hospital in case there is a major reaction. But without that, you don't really know if you have a true allergy or not. With food intolerances, with the exception of lactose intolerance, basically related to gluten, it is a rule-out condition. So you have ruled out celiac disease, you have ruled out true IgE allergies, you have ruled out any other condition that could possibly cause the same type of symptoms that you're experiencing. Once you've ruled everything else out, if by following an elimination of diet, removing gluten from your diet, you feel better, then you probably have a gluten intolerance that is not related to celiac disease. This is sometimes called non-celiac gluten intolerance, gluten sensitivity, gluten intolerance. We're also hearing the word gluten syndrome. All of that means not celiac disease. Why do you care? Well, the reason you care is in the treatment. One day, it's possible that people with gluten intolerances not related to celiac disease may be able to follow a low gluten diet and do just fine. Whereas if you had celiac disease and a medication became available, you would want to know that you qualify for it, possibly. And if you don't have that proper diagnosis, you possibly wouldn't qualify for the medication either. The other important factor is if you have a true IgE allergy that is potentially life-threatening, if you don't follow a very strict diet and avoid contamination, you run the risk of death. So knowing what you're reacting to and whether it's an allergy or an intolerance or celiac disease is very, very important. To help explain this in greater detail, GIG has published a paper on the differences between celiac disease and gluten intolerances. It's available at www.gluten.net. We also have a number of other educational materials there available online, free of charge, that you can download. If you have any questions, I'd be happy to answer them for you. My email is info@gluten.net. Thank you.